And you know what? I mean, you think about our lives and how we rush from place to place at the speed of light, and we ignore each other. I mean, he had slowed down. He was living mostly in the pure present, and he had slowed down enough, and he was noticing things that maybe he wouldn't have noticed otherwise.
Welcome to the Permission to Heal podcast. I am Marcy Brockman. Together, we will discover what brings us healing, meaning, and true joy. You only need your own permission to begin. Hi, I'm so excited to share with you the new Permission to Heal bookshop on bookshop.org. We all know how important it is to support our local and independent bookshops, and I've created a podcast dedicated bookshop on bookshop.org. So just follow along with me at Permission to Heal bookshop on bookshop.org. The link will be attached to the post, and you can have access to the entire catalog of books by my expert guests. You can just click and order from the independent bookshops and support everyone. It's pretty awesome. I've also put a bookshelf with my own Permission to Land books on it, and all sorts of books for inspirational help and books that I love. So join me on bookshop.org with the bookshop, the Permission to Heal bookshop. Hello, welcome to Permission to Heal. In today's conversation, I chat with Dr. Stephen G. Post. He is a very, very accomplished and very compassionate man. He is the founding director for the Center of Medical Humanities, Compassionate Care, and Bioethics Renaissance at Stony Brook University in New York. He is an opinion leader and a public speaker. He has served on the board of the John Templeton Foundation, which focuses on virtue and public life. He is a leader in research on the benefits of giving and on compassionate care in relation to improved patient outcomes and clinician well-being. He addressed the U.S. Congress on volunteerism and health, receiving the Congressional Certificate of Special Recognition for Outstanding Achievement. He is the co-recipient of the 2019 National Alpha Omega Alpha Honor Medical Society Professionalism Award for developing the professional identity formation curriculum of the Renaissance School of Medicine at Stony Brook University. Dr. Post has taught at the University of Chicago Medical School, Case Western Reserve University School of Medicine, and at the Stony Brook School of Medicine, where he is the director of the Medical Humanities, Compassionate Care, and Bioethics. He was an elected member of the College of Physicians of Philadelphia, the New York Academy of Medicine, the Royal Society of Medicine in London. Post is the author of 300 articles in well respected journals, peer reviewed journals throughout the world. Post is the recipient of the Alzheimer's Association National Distinguished Service Award in recognition of personal and professional outreach to the Alzheimer's Association chapters on ethics issues important to people with Alzheimer's and their families. Post's most recent book is called Dignity for Deeply Forgetful People: How Caregivers Can Meet the Challenges of Alzheimer's Disease, was just published this year, 2022, by Johns Hopkins University Press. His previous 3 books are Why Good Things Happen to Good People, How to Live Longer, Healthier, Happier Lives by the Simple Act of Giving, The Moral Challenge of Alzheimer's Disease, Ethical Issues from Diagnosis to Dying, and God and Love on Route 80, The Hidden Mystery of Human Connectedness. And he said during the interview that if you asked him where he was from, he would say Route 80, which begins by the George Washington Bridge at the northern dissection or intersection between New York and New Jersey, and ends in San Francisco, which is interesting. We had a lovely, deep, meaningful conversation about deeply forgetful people, about people who may have Alzheimer's, who are in the throes of dementia or deeply forgetfulness, as he puts it, and how we as caregivers can help our loved ones retain their sense of identity and value, and it's just very moving and very informative. So I hope that I hope that this connects with you. I hope that you find it as compassionate and necessary as I did. Thank you so much for being here. It moves me beyond words every single week that you show up and that you listen and learn and share and grow with myself and my guests. It's truthfully one of the most meaningful experiences of my life, having you all on this journey with me. Thank you so much. Great. Well, welcome, Dr. Post. How are you?
Hi, Marcy. I'm fine. I'm very happy to be speaking with you. It's always a delight.
I'm thrilled to have you here. We're pretty close. I'm in Kings Park. You're in Stony Brook. It's pretty quick. I teach over in Centereach during the school year, so
Oh, you do?
that's very close. Yeah, I'm a high school English teacher by day, or during the school year, and do
Good.
this on the side. And I've just gone back to graduate school to become a mental health counselor. So I will, in my late 50s, beginning a new career when I retire from teaching. So.
Well, good for you. Good for you. It sounds like a nice plan.
Yeah, you got to keep the brain active. I'm not one of those people who can just sort of retire and putter around. I need an action plan. So
Right.
that's the plan. So tell us a little about yourself. Why don't you introduce yourself? I know that I just read this very lengthy bio in the intro, and you have a lot of professional credits to your name, and you're a very busy man. But who is Stephen Post?
Other than his wife's husband of 40 years come August 18th.
Congratulations. That's a feat.
Well,
How'd you
it
do
is.
that?
Well,
One day at a
it's
time.
called sticking with him.
That's awesome. That's
Um,
awesome.
but I lived a very peaceful 13 years now in Stony Brook here, and I direct a Center for Medical Humanities and Compassionate Care and Bioethics in the Renaissance School of Medicine,
Okay.
which is the Stony Brook School of Medicine.
What is
And
medical humanities?
well, that's where if you see that thing on my wall back there,
I
that's where
do.
you have students from the time they get here reading um, narratives and literature about the illness experience so that they can be more sensitive to the subjective side of illness. And
Okay.
that includes, by the way, poetry and um, even art and observation. We do lots of things with artistic renditions of people who are ill with various conditions. And the students are writing reflections on these things. And then ideally, this will elicit um, empathic virtues.
Yes.
So if you see that thing on the wall there, that mandala, the blue concentric circle is the empathic virtues like humility, attentive listening, empathy, and so forth. And then the outer circle, the green one, that's the actual clinical experience that students and clinicians have here with patients. And hopefully, when they have to handle difficult issues that come up, and they do come up about treatment decisions and many other things, they'll be more skilled because they have these earlier building blocks in place.
Well, that makes a lot of
So,
sense.
yeah, that's what we do. And so we use the humanities, you being an English teacher, we
Yeah.
use the humanities to try to elevate the um, comfort and the care that patients experience when they could easily be reduced to a biological slab and a disease state, if you will.
Well, it makes a lot of sense because of all the things that I could have chosen to teach, I think, not only am I an avid reader and like a literature geek, I've always been, but I feel like, especially more and more as I become older and hopefully wiser, that we really have access to learning emotional intelligence by reading literature, by experiencing art and other people's thought processes, and what do people write about except the human experience? They write about relationships, they write about conflicts, and how they resolve these things. To me, teaches us emotional literacy.
Oh yeah, and the primary reason for medical error, and there's a lot of medical error in hospitals, is what's called premature diagnostic closure. That sounds like a lot, but it's not. It just means that instead of really observing carefully the patient who's right in front of you,
Mm-hmm.
you're just, basically reading off computer printouts 100 yards down the hallway and so forth. And you're not really being attentive to this human being in front of you. People misdiagnose all the time. And it's simply because they're not taught to observe.
Mm-hmm.
So art and observation classes, another area of medical humanities, they go on in about 800 medical schools around the country. Um, I'm sorry, I'm at 80 medical schools around the country. There aren't 800, but
800
there
would be great.
would be great. But there are very nice studies about how students who fine tune themselves neurologically to really notice things
Mm-hmm.
in a painting, in a rendition of an illness experience, how that actually shapes their own interaction with patients. And they become the kinds of people who stop, look, and listen and don't just ignore what's right there in front of them.
Do they get some of that information when they're taking a patient history, or maybe it's not the doctor who's taking the patient history in the first place? Maybe it's somebody else. I don't
Well,
know.
they do take the patient history often enough, but often also it's superficial and they don't palpate. There are a lot of residents, for example, who haven't really been trained to touch the patient, to really listen carefully with the stethoscope. This is one of the complaints of the older clinicians who talk about the lost art of healing and how they feel they can get a better diagnosis um, when they're just looking, smelling, feeling, and so forth, um, and not just relying on a lot of technology,
Mm-hmm.
AI, printouts, and so forth, because that's when you start missing the very obvious thing. So a lot of people are subjected to medical error but 70% of those are due to, again, just poor observational training. And the
Interesting.
observational training comes from observation, from literature, from just being sensitized to what people subjectively experience when they're ill.
Now, when you say literature, what do you mean? Do you mean fiction, or do you mean like anecdotal
Oh,
discussions of who the patients are, or
well, we have the students read fiction. It might be Chekhov's Misery or some such classic.
right,
It could be Ivan Illich and
right,
Dostoevsky, but or Tolstoy. But we want them to read literature. We also want them to read nonfiction. So things like When Breath Becomes Air
oh, I
are important.
love that.
Yeah. I mean, when they read
Beautiful
that,
story.
they see the kind of ups and downs of hope
Uh-huh.
and despair, and what really is success for a young resident, young physician whose family is in disarray, who's not very happy with life generally, and then he gets a severe diagnosis. How does that reorient him and make him completely rethink what it means to be flourishing and what it means to be
Right.
fulfilled? And in the end, of course, he does die, but before that, he's able to write this beautiful book where the words all jump off the page.
Mm-hmm.
And he also has a child. He becomes a father. So it's a really nice story for the medical students, but from their existential perspective of trying to understand what it is to have a life and be a
Yeah.
doctor and not
Right.
just be a gunner, but if you will, but also it helps them to realize the journey of an individual with cancer and where hope comes from, how people find hope, what hope is. All the great humanistic themes are just so deeply embedded in that book. So also poetry. They read a lot of doctors who have been poets of distinction. William Carlos Williams would be an example, but
Right.
also we have poets here at Stony Brook like Jack Coulihan and Richard Bronson, Maria Basil are all very distinguished physicians, but they also publish poetry and JAMA in the New England Journal and the Canadian Journal of Medicine,
Beautiful.
and that's the same kind of thing that a lot of people did in the past. I think we have it a little more strongly represented here. And narrative medicine, just writing reflective essays on this on the story of your patients, sometimes enhanced, by the way, when you actually visit them in the homes. And so
Right.
students all go into the homes because that's where you see the narrative of the patient. They're not just stripped bare
Right.
in a neutral environment. They're in their own home, so you see all the symbols that make up their lives and all the things that are who they are, which
Really
is really
helps you
good.
see the person, not just the pathology. You see the whole three-dimensionality of this person's existence, of their life, of their relationships, and
Yeah, yeah, very much so. And we have an approach that I like to call the double helix, because it's not just the patient's narrative, which is important to be
mm,
interested in, to be gently curious about, to invite that into your discussion so they feel like you're treating them as a whole self. But also the other piece of the coil is the experience that the clinician or the student has themselves emotionally in their response to that patient narrative. So there's the patient narrative, but there's also the narrative that you have as a reader, hermeneutically
sure.
as a reader. And so we like to make sure that people understand that and where the transference goes on and how that can be very complicated. But it's kind of the heart and soul of medical education here. And I mean, I'll just say that 2 years ago, Stony Brook was awarded the most prestigious award you can get in medical education,
Wow.
which is the Alpha Omega Alpha. That's like the cat's meow of medical education. Alpha
Congratulations.
Omega Alpha, yeah, for curricula in professional identity formation,
Wow.
which really means, the formation of certain kinds of core virtues like kindness and empathy and humility and compassion.
I think those
Uh,
are the, besides a diagnostic and intelligence, I think those are the things that we most look for as patients or as humans. We look for in doctors. You know, that
yeah, yeah, and
makes
that's why
up the relationship portion of the experience.
that's right. And so that's what we do here. I mean, we also, have a bioethics hospital committee, so we engage in the discussion of difficult quandaries with various patients and their families. And we do a lot of other things. We do a lot of clinical teaching. We do a lot of bedside type activities. Um, and so it's not just preclinical, but suffice it to say that the heart of it all comes from those concentric circles, beginning with the humanities, trying to help people become more humanistic in their approach, and then better clinically in their conversations with not just patients and families, but with one another.
Wow, that's you're doing a lot of good there in create. I mean, I think as the population is aging, we're relying much more on medicine. So being able to create or raise better doctors
Yes, yeah,
who are much more empathetic and caring, and or is going to put all of us in a better position.
yeah, and have the skill sets. I mean, we do
Yeah,
simulated role playing. We do actual interactions with patients that are carefully observed and critiqued, and so we really make it a part of the culture.
very cool. So you have written a new book.
Oh, yeah, I have, right. I forgot. No, I'm just kidding. Just
No, no,
kidding.
no, no, no. Well, you've written quite a few books over the years, all of which are linked in the show notes of the podcast. But you are sort of an Alzheimer's expert, so it seems.
Yeah,
Um,
I got into Alzheimer's before they even used the word. It was when my grandmother, who was a writer herself, uh, succumbed to dementia in the final years of her life and was in a nursing home. I would pop by and do assisted oral feeding. They didn't have feeding pegs. I don't believe in feeding pegs. They're not as constructive and meaningful as assisted oral feeding.
I don't
But I
even know
used to
what a
do,
feeding peg is, but okay.
well, that's right. Well, there are these tubes that people now in many nursing homes get get placed usually through an incision in the abdomen into the stomach, but they're not really um, very helpful. They actually shorten life. They cause a lot of aspiration pneumonia, and so you're better off just doing what they did before 1985, which is to go there and say, okay, applesauce and bran, and even my grandmother wasn't speaking with me,
Mm-hmm.
um, or clearly recognizing me at least verbally. There was a lot going on almost ritually. It was kind of a rite of
Sure.
passage, and there was a lot of emotionality, and sometimes her eyes would really light up, and you could see a lot of emotion. And then I had to be open to surprises because there were those moments when, lo and behold, she would call me by name.
Right.
So I had the impression as a younger person that you can never uh, think of these individuals as gone, as absent, as husks, as shells, and so forth. And I didn't like the word dementia
Okay.
because it's if you think just about it in terms of its derivation, it's a negative term. It's a decline from a former mental state.
Mm-hmm.
But we don't call people retards.
No, not anymore.
Not anymore. Yeah, I mean
No.
we call them, disabled. We call them handicapped. We call them a lot of different things. Now we call them differently abled.
Sure.
Um, um, but dementia has the same sort of construction. So I like this language, which is catching on, and I'm really happy to have pushed it over the years, of deeply forgetful people. Because to be honest, Marcy, I had an experience a couple of years ago. I went out in the parking lot behind this brutalist architecture that we call medical school,
Yes.
and I couldn't remember where I parked my car.
That
So I
happens
asked
all
a
the
medical
time.
student, yeah, I do. Do you know where I parked my car? Of course she didn't know. And I said, then, do you even know if I drove to work today? Which was kind of shocked her and she laughed. But we all have our moments, and um I think deep forgetfulness is almost more mystical in a way, but it's a continuity with common human experience. We like to think, okay, they're demented, they're over the line, and we're not demented. But the
Right.
reality is that, it's kind of a spectrum, and we all have those times in life, and some people have what they call pseudo dementia, which is dementia related to transient episode of depression or anxiety disorder or whatever.
Right.
And so I'm when we're babies, of course, we don't have memories to speak of. We might have a little emotional memory after 6 months or a year, but I think it's important to try to find ways of connecting, and so the language of deeply forgetful, I think, encourages me and others to notice, to do the work of noticing those
Mhm.
signs, those hints of continuing self-identity. Whereas dementia does the opposite. Dementia invites these kinds of
It invites dismissal.
yeah, dismissal, negative metaphors, them versus us, there but for the grace of God go I. And that gets us in a lot of trouble because the book is about dignity, and we begin to humiliate, we begin to de-dignify. There's a word for you, de-dignify.
De-dignify,
That's
right?
actually in the book.
Right. Well, it's dignity for deeply forgetful people. So
Yeah. Yeah, and even the cover, which I had nothing to do with, the cover which you
it's
show is
beautiful.
the Hopkins people, Johns Hopkins Press did that, but it's I don't people respond to it in different ways, and but for me it's opaque. It's the fact that the person is still there. They
Yeah.
may be opaque, they may be less able to communicate, they may be in and out, they may be uh, somehow obscured, but they're still there. And anybody who's spent 90% of caregivers, for example, will report what I talk about in the book, instances of paradoxical lucidity, where
Mm-hmm.
someone who's just, had their chin down and hasn't communicated for a long time, even weeks, even a month or two. But with the right stimulation, it could be deeply personal music, with the Alzheimer's poets in Brooklyn who read, say, The Road Less Traveled, and uh, about 90% of the patients, or of the people with dementia who are brought into this center, will start to chime in for at least a line or so. So you can
Wow.
bring people back with deeply learned material, because although short-term memory is very much diminished, um, and it can be the case that their long-term memory is also diminished. Actually, their long-term memory is relatively stable, and
Yeah, I'm
so
finding that with my dad that he forgets the medium things, things that happened within the last few days,
yeah,
and he'll forget things that happened within the last 10 minutes or the last hour, but he could tell you what he ate for dinner on January 6, 1957.
right.
Like that's in there forever. That's
That's
not
in there.
ever leaving.
Yeah, and that's what the music and memory thing is. Dan Cohen, who started that, lives on Long Island in Mineola. It's a good friend of mine, and we've written some papers together about it. But it's amazing, because if you take someone who's, say, in the VA nursing home here on the Stony Brook campus, it's a big, big nursing home,
Mm-hmm.
and there's a big unit for people who are um, quote unquote Alzheimer's patients, or residents. And if you approach them with some music that they really identify with from their younger years, like for me, it would be "I Want to Hold Your Hand,"
Mm-hmm.
you know,
Sure.
then they will get somatic, they'll liven up, they'll get back into themselves, and good heavens, they'll even be able, a certain percentage of them, to converse a little bit, maybe for 4 or 5 minutes after this experience. But part of the book too is about how to use language.
Yeah.
You're a linguist, so don't ever ask an open-ended question like, "Hey, how are your kids?" Because you put the person on the defensive. They've got to remember names and
Mm-hmm.
so forth. What you say is, "How's Joe?" And then,
Be
how
real
Susan,
specific, right?
yeah, and they'll light up, and you're using language to remind them, to get them off the hook, if you will, of forgetfulness.
Right.
That works really well. And there are many, many stories in the book of how to communicate more effectively with these individuals by using language in certain ways. Don't ever say, "What would you like for breakfast?" but say, "Hey, you
Give them
want an omelet,
choices. Right.
or
Give them
are you good with post toasties?"
right. Right. But it reminds me, my very good friend of mine was the primary caretaker for both of his parents as they were declining, and he wanted to keep them home, which was their wishes for their whole lives. So they had like a rotation of home healthcare aides, and he was the primary, and his mom hadn't said anything. She couldn't, she was in a chair, she could barely feed herself, and he came in and put on her favorites. Like, she was being difficult with one of the caregivers and was refusing to eat, and so he put on one of her favorite songs, and he sat down and he took over. And not only did she eat her whole meal, whatever that was, with the music, but she was even moving her body a little bit and lifting up her hands and like doing whatever she could to sort of dance with him as he was singing the song to her. And it's one of his favorite memories from the last like year or so of her life. It was just this like lucidity, the sunshine in the middle of the
Yeah,
cloud.
yeah, and so in New York, although it's been closed down for a little while because of this pandemic stuff, but NYU has a program called the Unforgettables,
Nice.
and it's a choir of caregivers and affected individuals. And when they come together for these big rehearsals, and there can be even 100 of them in the choir, people graduate and they go on into the more intensive treatment situations. But so long as they're not very, very severely forgetful, it's like an awakening for them.
Mm-hmm.
They will connect with one another. They want to dance. They want to be somatic, and when they do that, they kind of come back into who they are. Okay,
Yeah.
and this is really powerful. So the NIH, National Institutes of Health, funds research now on what's called, again, paradoxical lucidity, the things we can do with these individuals to bring them back into themselves, and then how can we study that in relationship to the neurology of deep forgetfulness itself. And they're making some pretty good progress. They're gaining insights into dementia that they didn't have previously. So there's a lot to be done. And also, I'm wearing a shirt. It's got dogs on it.
Yes, we were noticing that before. Cute
Yeah,
little brown dogs.
cute little brown dogs. So I was on the board of the Alzheimer's Association in Stirling in Scotland. This is like 25, 30 years ago.
Wow.
And uh, we started the Alzheimer's dogs movement. And I talk about the dogs in the book. So, they're trained dogs and they're well
Sure.
matched. So, they're sort of, smaller sized Labradors typically. And this is the hottest thing in Great Britain and Scotland. It's all over Australia. I give the websites for the Dogs for Australia website. I was in Sydney doing a big national workshop on the kinds of things we can do with music, with art, with images that bring people into familiar zones, Joe DiMaggio, Marilyn Monroe, whatever,
Of
it's
course.
all stimulating, but a dog is probably the best thing. So um, uh, people have these almost miraculous experiences of almost rementia because they get so engaged with this dog, and the dog doesn't give a damn if they're forgetful or not,
No.
right?
Right.
And and there they are. It's a beautiful thing. So we had about 50 people with probable Alzheimer's disease, and I say probable because in most cases it's a mixed diagnosis. It's not pure Alzheimer's.
Of course.
It's vascular stuff. It could be chronic traumatic stuff because people got hit in the head too much when they were playing football once upon a time, Who knows? But we went down the main drag of Sydney, and all these wonderful dogs had purple forget me not vests,
Nice.
right? And everybody was perfectly happy, and the dogs were getting people across the street, and it was all going so well. Nobody was acting aggressively or agitated. It was just a beautiful, beautiful experience. And a cab driver pulls up next to me and he says, "Hey, man, dogs are for blind people."
Not necessarily.
Yeah. And so that's how we think of it. But actually, we should do a lot more with these Alzheimer's dogs. And there are so many other things. I mean, Willem de Kooning, the great abstract expressionist, he was diagnosed at Cornell with probable Alzheimer's, and he died 14 years later. But for 13 and a half years, he painted. And his painting was actually, I mean, his early stuff is that kind of wild-eyed, anxious stuff that people like de Kooning and Larry Rivers and others were typically producing. But when he got demented, he actually mellowed out. Sometimes you hear about the reverse, but in his case, and in most cases, he actually mellowed out. And he started painting a little bit more like Georgia O'Keeffe.
Ah.
You know, I mean, it wasn't as elaborate, it wasn't as complicated, admittedly, but it was in a way more beautiful. It's like a part of him had been disinhibited, maybe because he'd forgotten the myth that a lot of people grow up with, which is that I don't do nothing for nothing.
Right.
You know, he'd forgotten about all of that transactional mentality that
He
kept
was
him
just
from
painting for the joy of it.
yeah, he was just painting for the joy of it. And he got into more positive emotional elements. So I was very impressed by that. And there was a posthumous exhibit in New York of his work, and it was really quite beautiful. The reviewers said, a lot of them said, well, this is an embarrassment to de Kooning because it lacks all the rigor and the complexity and the linear depth of his earlier work. It's just not the true de Kooning. But someone said, I think it was a reviewer from the New Yorker, said, wait a minute, this guy, he had Alzheimer's disease for 14 years. And for about 13 and a half years, he knew who he was.
Right.
You know, and he would rise up sporadically. He couldn't talk much. He liked his dungarees because they reminded him of who he was. And he'd dip his paint in his brush in the acrylic, and he'd go up to the easel and he'd paint this stuff. And I thought it was a great example of that. So his linear rationality, like the how to do rationality. How do I get out to the corner and buy a cup of coffee? That may be quite deteriorated, and in fact, entirely so. That the rationality of doing, of going from point A to point B over time. But what's not gone in these individuals ever is symbolic rationality. Okay. So I knew a guy who worked in the steel mills on the west side of the Cuyahoga River in Cleveland. I've been a Clevelander, originally. And oh my goodness, he always dressed country and Western. He becomes quite severely demented. In fact, very severely demented. He's even in the final stages of what we would call terminal dementia, but he still clings to his cowboy hat, and sleeps with it.
It's part of his identity.
Yeah, because he knew that somehow his identity was wrapped up in that. And I knew being out in my Ohio days, I went with a famous neurologist, Joseph Foley, who'd come to Case Western from Harvard, and he was just the premier neurologist of his decade, of his generation, actually. And we went to a nursing home called Heather Hill, and they had a special care unit for people who were deeply forgetful. So we read the bio sketch on the wall, which is a nice humanizing idea. That's a use of narrative, told about this fellow's family and what he had done in life. So we asked the nurse to take us out and introduce us to Jim, which she did. And I took Jim by the hand, and I took him to a table, sat him down, and I said, Jim, now I used language poorly. I said, how are your sons? Because I knew he had two sons.
Right.
And he couldn't respond at all. But then I said, how's Zach? And he just got euphoric. He wasn't coherent, but he got euphoric.
Right.
And I said, how's Susie? And he was just smiling like a radiant beam of light. And so that's when I really began to realize how we use language makes a difference. So then this guy, he had a white twig, like a branch, about a foot long, and it was carefully sanded and it didn't have any sharp edges, thank goodness. And he put it in my hands. And when he did that, he smiled this effusive smile. And I'm telling you, if joy was electric, that place would have been on fire. And I said to the nurse, I asked the nurse, so, okay, what's the story with Jim and this twig? And she said, well, when he was a boy, he grew up on a farm and he was very, very close to his father. And he's now mostly living back. That's the deeply remembered stuff we're talking
Sure.
about. He's mostly living back in that time of his life that he most associated with tender, loving care. And and his father gave him a chore every morning, which was to bring kindling in for the fireplace.
Oh,
So there was purpose in that you and I wouldn't pick that up, but
right.
there was purpose. And when Jim was giving that to me, he was saying, you know what? This is a symbol of the love of my life.
Right.
And then there was this beat up rag doll. I don't know if when you were a kid, if you had a puppet doll that you could put on your hand that was sort of, you know,
Yeah.
okay. So there was this really ragged puppet doll. I mean, I tell you, it had to have been 40 years old and had been stepped on and slobbered on and so forth.
Well
And
loved.
yeah, yeah, well loved. And it was right there on the floor. And Jim actually slowly ambulated to it, picked it up, and he brought it to a woman in the corner of the unit who was whimpering and crying.
It was
And he
hers.
put it on her lap, and it was hers. And I asked the nurse, yeah, because that was hers. So he had some emotional intelligence
Right.
and
He
some
knew.
symbolic.
Right.
I mean, and you know what? I mean, you think about our lives and how we rush from place to place at the speed of light, and we ignore each other. I mean, he had slowed down. He was living mostly in the pure present, and he had slowed down enough, and he was noticing things that maybe he wouldn't have noticed otherwise.
Mm-hmm.
You know,
It's beautiful.
you know.
So both of my parents, my dad's in his early 80s and my stepmom's in her late 70s, are in the beginning stages of this, and they're still living on their own. And my sisters and I have just taken over, legal financial control and power of attorney and healthcare proxies and so forth. And we're having lots of conversations with them while they're still mostly lucid about how they want their lives and their deaths to go, and before it's too late. Getting directions from them now while they still remember what they want and they still have some shred of their identity or lots of shreds of their identity left, how they want the rest of this to go so that we can take care of them in the manner in which they
Yeah.
want to be taken care of. How do we know, or how does anybody know, when it's time, or if it becomes time to take them out of their homes and bring them somewhere else? Or is it always advisable, when possible, to keep them in their homes with caregivers?
That's a good question, and there are a lot of variations on the theme. Most older adults will extract a promise from their adult children, like yourself. Don't ever put me in a nursing home. But
Well, but even in
nursing
assisted living kind
in
of
assisted
thing.
living, yeah, yeah. But uh, nursing homes, it's such a drab sort of hospital type image. Assisted living is much more creative now, and I think there comes a point where it is very difficult for family members, uh, and even with a live-in caregiver, to manage behaviors.
Mm-hmm.
And so at that point, when it just becomes overwhelming, you definitely do want to make use of professional help and get someone to assisted living. It doesn't mean that you're abandoning them, because you can still pop in and visit every day. I always recommend that to families, and you can be a part of their lives. It's just a relocation. Uh, and caregivers, family caregivers do have, on the whole, a higher depression rate than the general population. It's not hugely higher, but it's significantly higher. And that's something that we have to think about. There's a book called The 36-Hour Day, which discusses sort of what it's like to be a caregiver. And you can never really get to sleep because your loved one's sleep-wake cycles are interrupted.
Right.
And
It's
and
like
so
having a
this,
little kid again.
yeah. So this is a big problem. Uh, you know, the thing I like to say is that respite care makes a huge difference. So some years ago, the whole Alzheimer's Association nationally had a big meeting in Washington, D.C., and the whole focus was to have the government support respite care for Alzheimer's caregivers in the home. And that's how I kind of broke into this field in like 1988 when I was out at Case Western. I spent about a half a day a week doing respite care. And
What do you mean by that? Giving caregivers a break?
giving them a break. Yeah, just
Yeah.
okay. So
Okay.
coming into a home and letting the caregiver um, go out to the movies or go out and get a cup of tea with friends, go shopping, just relax a little bit, take a walk in the park. It's incredibly beneficial. And we had some reliable studies showing that if you just gave a caregiver 5 to 6 hours a week, one day,
Mm-hmm.
that would ameliorate this problem of increased depression.
Makes a
So
lot of sense.
it's a lot of sense, and it's actually cost effective. So yeah, we had there were hundreds of people from every state in the U.S. We went up early that evening to Capitol Hill with our um, candles, and we approached our senators and congressmen and showed them the data, and that we wanted to start this movement, and it needed to be paid for. And it was very worthwhile, probably more beneficial to a lot of these people who were deeply forgetful than even drug studies, because the drugs aren't doing too much. And they said no, because if we did it for Alzheimer's caregivers, we'd have to do it for other caregivers as well,
Well,
which kind
maybe
of
we
gets
should.
which we should, which sort of gets to another issue, which I highlight in the book, that a lot of times affected individuals, but also their caregivers, they just really, what do we do in terms of justice, economic justice?
Mm-hmm.
So, we give them scraps, we give them leftovers, we wait till they've spent down,
Right.
into relative poverty, like say about $15,000 in assets, including whatever is left in their home, before they can qualify for public
That's
benefits.
ridiculous. It's ridiculous.
Yeah. Now in Canada, I'm not going to just say Canada's the best place in the world, because it's not. But in Canada, their healthcare system, it doesn't spend every penny possible to rescue someone from death like we do. And by the
Mm-hmm.
way, 95% of older adults in many studies, if you're just questioning them in the lobby of a primary care office, they will tell you, if they were to become deeply forgetful and with a profound dementia, they don't want any aggressive treatment. They don't want a tube in any orifice, natural
Mm-hmm.
or unnatural. They don't even want to get shots anymore for diabetes. They
Really?
don't want to. They don't want their treatment for, say, a chronic cardiac problem, which can be very complicated.
Mm-hmm.
They don't even want to necessarily be treated for uh, a cancer, right? They just want to go in peace, and we need to assure them of that.
Mm-hmm.
But unfortunately, it's often not the case. I mean, in every hospital in America right now, I guarantee you that 5 to 10% of the people in the intensive care units have deep forgetfulness. So we need
And
to work
family
real.
members who are clinging tightly while the
Yeah,
deeply forgetful person wants to let go.
yeah, absolutely. So one of the things I did, I actually got on the cover of the Wall Street Journal about 18 years ago because I'm against the use of artificial nutrition and hydration. Look, when people can no longer swallow, although it can be stimulated, as you pointed out,
Mm.
by personalized music. I have a study out with Dan Cohen, who founded Music in Memory, showing that if you give people who are losing their capacity to swallow an intervention with personalized music and an iPod and get them back into themselves, they actually remember how to swallow, and
Right.
then they can feed themselves and they can have dinner or whatever. But
You need to get them back into their bodies.
yeah, need to get them back into it, and it can work very effectively. But lo and behold, I mean, these feeding pegs, which were only invented by um, two surgeons at Case Western, actually, um, uh, for children. They were in the Rainbow Babies Children's Hospital, and it was for children who had esophageal blockages, and you couldn't put a tube down their throat because it wouldn't hold up over time, and it would have negative side effects. So they figured out this percutaneous endoscopic feeding. Don't write that down, anybody.
No, that's a lot of
Yeah,
multisyllabic words there.
no, no. But I got to tell you that causes aspiration pneumonia. Also, if someone who's deeply forgetful has no insight into what that little 3-inch white rubber tube is sticking out of their belly button area. So they pull it out. And that's the main reason why people still get tied down and physically restrained in nursing homes. And then they're sitting in their urine or whatever it might be, and they're getting lots of skin infections and they're dying.
Right. At that
And
point, there
and
is no quality of life at all.
no quality of life at all. And historically, up until 1985, nobody in the world with advanced dementia who was in the end stage was given a feeding peg. It just didn't happen. It was all assisted oral feeding,
Mm-hmm.
which is what I did with old Grandma Post.
Sure.
And now, in Canada, they don't do any assisted oral feeding. In most parts of the world, they don't. But somehow or another, it's partly financial because there's more reimbursement for nursing homes if you're doing skilled nursing care than
Mm-hmm.
what's called routine nursing care. So there is a revenue element to it,
That's
as there is to most
disgusting.
things. Yeah,
I
but
find that so disturbing.
oh, it is, and so the reason I got in the Wall Street Journal, way back in the day, was that there was too much of this going on in Greater Cleveland, and I was working with adult children. Right, I'm going to have a sip of tea if I can.
Yeah, of course.
Because I mean, adult children usually have a little different viewpoint than the spouse, because the spouse, like their husband or wife or whomever, they've been there, done that. They're looking more retrospectively at life,
Mm-hmm.
and they may not see much value in sort of trying to push it to the nth degree for that last little bit of time when quality is not there. Um, but the adult children, because of attachment, this is my mom, and I've been able to call my mom on my cell phone forever. And hey, mom, it's me.
Right.
It's
They're
a little
less likely
harder.
to let go.
Yeah, less like, and that's proven. It's in the literature. They're less likely to let go. So I organized a whole movement in Cleveland, and we were doing clinical ethics consultations in nursing homes and in hospitals too, but mainly in nursing homes. And I was very skilled at nicely, diplomatically convincing adult children not to use feeding pigs. And I wasn't being rude, or I always said, it's your choice. In the end, it's your choice. I mean, you have every legal right as a family member or as a legal proxy or whatever to make this decision. But think of it in terms of compassion,
Yes.
not in terms of whose right it is to make this decision, or even necessarily of what mom or dad would have wanted, but just think about it in terms of what they're going to go through. And it's not necessarily a good thing. They may get an additional, in some cases, not in general, but in some cases, of a few extra weeks of life, but not if you give them assisted oral feeding. If that's available,
Hmm.
then they'll probably live less time than they would otherwise. I'm all for hospice treatment. I'm all for minimally invasive treatment. I think it's ridiculous that these people wind up in the intensive care unit. And I got to tell you that the students don't like it either. I mean, the medical students, they see this stuff, you talk to them about it, and they can't fathom it. They don't get it.
It's heartbreaking.
You know,
Now, if we could go back to earlier stages, you know, when maybe when diagnoses are first being given, when the dementia is first starting to take hold, um, how can the caregivers, the children, let's say, help the um, I don't know how to phrase this as the deeply forgetful, the not so deeply forgetful yet person reestablish their own personal identity. You know, if they've always imagined themselves as strong or cognitively flexible, and how do you help them mitigate the change of that?
well, it's difficult, especially while they still have insight into their losses. I hate to use the word kind eh,
Mm-hmm.
when it comes to something like Alzheimer's, but if there is a kind point, it comes when people forget that they forget.
Well, that's a spot where my dad's in. You know, he's forgotten what he no longer remembers.
Right.
So, although he's constantly living this retrospective of his life
Mhm.
and wants to tell me about all sorts of things that happened in his childhood and what he
Well,
did when he was younger, it's like he's reliving everything. And
mhm.
so I'm constantly going down memory lane with him over and over and over again, which is fine. That's what he needs to do. He's in a happy place.
Yes, he is.
But other people who are aware of their losses, they're
Right.
aware of the loss of what they remember what they used to be able to do, the
Right.
thought processes they were able to remember, the multitasking that they could do, the things that they were able to handle, and they're depressed and anxious and
Yes.
lonely and irritated and really in a very bad place and exceedingly frustrated. Like, how can we help them?
Yeah. Well, you have to be very present, and you have to work with them in areas where they do have some history and some competence, doing things that they can identify with. But it's going to be difficult. While they are still insightful into this loss, there are uh, higher levels of depression in those
Mm-hmm.
very mild stages. And you're not going to necessarily have a smooth emotional transition at all. There can be a
No.
lot of agitation, and someone who's been perfectly kind and compassionate over the years can become very edgy and difficult. So I would say, and by the way, a fair number of people will be asking their doctor um, if they can engage in assisted suicide. Many neurologists report this.
Oh, yeah.
But when they forget that they forget, then they can have a relatively benign emotional adjustment. Now, not always. There's a certain percentage, maybe 20-30%, who do have issues of aggression and agitation and make it very difficult, but they can be cared for in special ways.
Mm-hmm.
Um, uh, and that doesn't mean sedated. I mean, there are pretty good medications for some of these behavioral challenges. I think that yeah, I mean, when they get to a certain stage, that's where Oliver Sacks comes into play. The man who mistook his wife for a hat. I mean, you have to enter into their reality. Now, so in the old days, I mean, 40 years ago, 30 years ago, a lot of times you'd have big rooms in nursing homes, and people with dementia would be sitting there, and some fool would be up at the blackboard asking them, "What year is this?"
Oh God.
Maybe a couple of them would respond, but most wouldn't. Then he write 1984, and this was called reality therapy. It didn't work out very well. But now, what you have, you have, for example, in Brooklyn, in the Brooklyn Memory Disorders Center, you have the Alzheimer's poets, and what they do, they're like almost like musicians. You'll get 20 or 30 people coming in from the community with their caregivers. They'll sit in these nice chairs along the walls in a circle, and someone will read with energy and musicality, like a Robert Bly, who was my
Mm-hmm.
poetry teacher at Reed College, by the way.
Wow.
Um, they'll do the road less traveled, because this is a cohort that's likely going to respond to Robert Frost,
Sure.
and they don't just read it. They say, the road less. They get dramatic, and they do it beautifully. And by goodness, and I've witnessed this many times because I used to be on the board of that organization. The vast majority, I'm talking about 90%, will chime in. They will not necessarily recite a verse, but they'll be able to pick up on a line or two.
Mm-hmm.
They'll get somatic, they'll get emotional, and they'll lighten up and brighten up. It's a beautiful, beautiful thing. And then afterwards, some of them will even be able to have some brief conversation with their caregivers who are with them.
Mm-hmm.
Now, some of the people I know, the ethicists, they say, well, this is completely meaningless because it's a fleeting experience. I mean, they're still going to drift back into the doldrums of deep forgetfulness. But I say, look, for their caregivers, it's fabulous, because what they realize is that they're not wasting their time.
Right.
This isn't a husk or a shell or someone who's, quote unquote, half dead, but this is still grandma. That's why chapter 7 of the book
Mm-hmm.
is called "Is Grandma Still There?" And
Grandma's still there, all right.
grandma's still there, and anybody who says anything to the contrary is being completely presumptuous. And by the way, this gets so there are a lot of things that you can do to connect with these people, early on, and also in the intermediate phase, but even in the advanced stages, there are things that can be done. I mean, I knew a guy, I knew a woman at Yale she was at Yale University. Her husband, Leander Keck, was a distinguished professor at Yale Divinity School.
Okay.
He was a professor of New Testament exegesis,
All right.
and world class. And Janet Keck, his wife, became deeply forgetful, and she would there's a book written about her. She would wander around the Yale Divinity School campus, and people would be polite and gracious and generous and try to help her out a little bit. But but eventually she became very deeply forgetful. But when she came into the Yale chapel on Sunday mornings, it's a Protestant outfit,
Mm-hmm.
and she heard those hymns that she grew up with and remembered meaningfully. When she heard a familiar prayer, when she saw the lights through the stained glass windows, she would just liven right up, and she would get back to herself. And so with all of that symbolic stimulation, that's why I say, symbolic rationality is actually more important than linear rationality. Linear rationality is the rationality of what we do. And in our society, we're always thinking about what people accomplish, what they do, and that's where your value comes. Otherwise, you're as the Germans said in the World War, that you're a useless eater, and then they exterminated
Right.
people. But what's more important ethically is the rationality of who you are, and that's captured in symbols more than anything else. And so for Janet Keck, it was the symbolic environment. So that's why, it is good to keep people in a familiar environment where they can connect with symbols and stimulate them with symbols as much as you can. And when they go to a nursing home, if they go to a nursing home or assisted living, make sure that symbolic reality is still around them. So you go into a good nursing home and they'll be in a room and they've got all these things from home that are up on the
On the wall,
shelves.
yeah.
And that's very important because there's a great philosopher named Ernst Cassirer. I used to read him when I was a college student, and he was the philosopher of symbols. And he says something that you, Marcy, will understand because you're a literary person.
Sure.
He said, "We live in symbols, and symbols live in us. We live in symbols, and symbols live in us." And all the good people with, you know, uh, uh, what is it, Caring Connect in New York, all these organizations, people who are trained to really connect with the deeply forgetful. They do it. They have every kind of imaginable little artifact, device, and they're so skilled. It's a beautiful thing to see them work and bring people out of themselves. So that's the point of the language of deep forgetfulness, is that the person is still there. Dementia, it's like you said earlier, it's so much easier to just kind of write them off. They're
Uh-huh.
demented, they're not functional. But deep forgetfulness, it invites more compassion, more
It
interest,
absolutely
more,
does.
yeah, more of a gentle curiosity, you know,
Hmm.
more kindness, more patience, forbearance, forgiveness, more love.
And it helps us. I think I know with me, it helped me realize that memory is a continuum. That I mean, I'm 54, and there's a lot of shit that I already forgetting. And so when I see my dad who's 82, you know, I don't know. It brings more compassion. I start to see it as a different thing rather than, oh, he's just demented. It's not. Well, that's ridiculous. I don't even like saying that. He just forgets stuff, so he repeats himself. I remind him that he already told me, then he forgets that, and then we say it again. And
Yeah,
you know,
yeah. And and a lot of people react, okay, they can't even remember my name.
mm-hmm.
Uh, that's really not very relevant.
Right.
I mean, I mean, there's like 500 medical students in this building, and at some point or another, I've been introduced to every one of them. But when I ride the escalator up,
Well, that's too many names to remember.
anyway, but I'm always forgetting names, and it's and it and we often get embarrassed a little bit, and we kind of confabulate, and we skirt around our forgetting someone's name because we feel embarrassed. We shouldn't be forgetting that name, but it happens to us all, and the fact that it's more common for someone who's deeply forgetful to miss names is not something we should really worry about. The point is, are they present? Are they
Mm-hmm.
emotionally present? And in this book, I actually go out on a little bit of a limb. So you'll notice it's endorsed by His Holiness the Dalai Lama.
I noticed that.
Yeah. So I have this in front of my desk here as I'm speaking with you. So in 2015, I was invited to the Indian National Institute for Advanced Studies to head a conference they were having on the deeply forgetful.
Okay.
And it was renowned neurologists and philosophers from India. So most of them were Hindu. There were some Americans like Owen Flanagan and others, but it was mostly Hindu. And the Hindus are great. I tell a story in the book of going with Joe Foley, Dr. Foley, to a geriatric psychiatric hospital in Mount Vernon, Ohio,
Okay.
about an hour south of Cleveland, about an hour west of Pittsburgh, in case anybody wants to know. And there it is. And they have a special unit with about 40 or 50 folks who had Down syndrome. And now they're in their 50s and 60s. And they're also having increased deterioration because most people in that category do, in fact, have probable Alzheimer's disease.
Interesting.
And so there were these incredible Hindu nurses and nurses' aides and a couple of doctors, a couple of physician assistants. And they had a little community near this hospital. And Joe Foley and I walked in there, and we were awestruck. We were awestruck by the calmness, the beauty of their interactions with these individuals. They weren't reacting, they were responding with self-control, with mindfulness, right?
Mm-hmm.
And it was a beautiful thing to see. And they were calming these people down left and right when they got kind of panicky and a little bit off kilter. So we took several of these nurses and nurses' aides out to a diner in Gambier, Ohio. It's actually a pizza restaurant. Um, um, and we just asked them, so what is it that makes you care so meticulously and with such warmth and patience? And they said uniformly, namaste, which means technically it's a Hindu greeting. It means
Yeah,
I honor the divine in you as you honor the divine in me.
sure.
And so when I was in Bangalore, getting back to Bangalore, okay, I gave this talk about how, we in the West, we're so influenced by what I call hypercognitive values.
Mm-hmm.
It's a word I invented when I was at Case Medical School in about 1995. Hypercognitive values. We think that people are only useful and of worth and dignity if their cognition, their linear rationality is intact. And when that's gone, we we just don't really care much anymore. Um, so I gave this talk and I said, what's really important is their consciousness. I mean, someone can be deeply forgetful and perfectly conscious of the beauty of a piece of music, or the beauty of the fall leaves, or they can
Oh, the
smell an
warmth
apple,
of a loving hug. Yeah,
warmth of a loving hug, or they can still smell that apple pie that's just kind of like the one grandma used to make.
sure.
It's the only thing I ever eat at McDonald's about twice a year is an apple pie,
Is
because
it
it
good?
reminds me of, yeah, well, it reminds me almost exactly what my grandmother McGee used to make out in Sagaponack when I was a kid.
Okay.
So there you go. You know, it's not healthy. It's not healthy, but it just makes me feel comfortable. So, that's the
Well,
thing
there's
there.
a fabulous bakery out that way. Oh, what the heck's it called? I'll think of it. They're
Uh,
just famous for their pies.
oh
Oh
yeah,
my
there
god.
is one. There is one on 25A. Yeah,
Yeah,
it's
yeah, yeah, yeah.
yeah,
On our way out to the Orient Point Ferry, we always stop there.
yeah.
I
They
can't
have
remember what it's called,
great
but
stuff.
a pot.
So
Oh
that
my
I like
god.
going there too. But so basically my point is, they have consciousness. And what's important is that they are aware of their existence. They are self-aware. They may be deeply forgetful, but they'll have moments of relative lucidity.
Mm-hmm.
And so you have to be open to surprises, and you can't treat them like they're dead. Now, if someone is in a persistent vegetative state, which is to say they have no brain function going on other than the brain stem, but all of the personality, everything you associate with being human is kind of gone. Well, that's different. And we actually um, um, take people who are PVS and we extubate them typically.
Mm-hmm.
Um, uh, uh, or they could be brain dead. Even their brain stem could be non-functional, in which case we just say, well, they're dead. So, a person who's deeply forgetful is not dead.
No, definitely not.
Yeah. There's a great website called Not Dead Yet,
That's great.
which I want to recommend to your listeners. It's actually um, supported by the disability movement, because the disability movements, they're kind of hesitant about bioethics, because a lot of what we bioethicists do is we kind of figure out, okay, when is it okay to pull the plug? It's that sort of thing.
Right.
And how can we respect people's autonomy and their decision making when they don't want to be overtreated? But for the disability movement, a lot of times it's not about the individual, but it's about the group they represent,
Mm-hmm.
right? So if you look at, World War II, people with spina bifida, people with cognitive disabilities wound up in the hypothermia experiments. And so it's not so much a question of, can we limit treatment, but can we keep people here as a community to be respected? It's a very different take. So it's so interesting. I'm not sure where we want to go with this, but I just tell you that this is important. I spent 30 years traveling around the US, visiting Alzheimer's chapters all across Canada, every province. I love Canada because they have these things called Good Samaritan organizations, and they provide free, getting back to that point we missed before, free long-term care and hospice for everybody with a diagnosis of dementia.
Wow.
Plus, they give them, if they need it, a free iPod so they can do personalized music.
Wow.
Yeah. Peter Whitehouse and I actually were part of the Alzheimer's Canada National Task Force, and we got these things moving forward in there. But so they're not going to be resuscitating people who are deeply forgetful. They're not going to be pounding on their hearts. They're not going to be throwing tubes in them. They're not going to be insisting that they be treated surgically for a tumor unless it's absolutely necessary for palliation. And there are some cases like that. But look, I mean, you basically, this is a good time to count your blessings and get ready to go. And even if you're not lucid of mind, most people, while they still are lucid of mind, would prefer that. There's a chapter there in the book on preemptive assisted suicide.
Which you do not agree with.
Well, I'm clear that I don't promote it, but when I was at the University of Chicago, I had two psychiatrists who were mentors, because I did a lot of stuff in psychiatry and medicine and philosophy and deconstruction, all that kind of stuff. And they both had a diagnosis of probable Alzheimer's. One of them had a beautiful family, and he loved his family, and he trusted them to keep an eye on him as he progressed, and his life still had quality. So he lived another 12 years. The other one took 40 Secanols and put a plastic bag over his head, and I read about him the next day in the Chicago Tribune.
Oh my God.
And so that was a real contrast. But he had no family at all, and he just didn't have confidence in the system to kind of not overtreat him and just sort of let him go naturally.
Right.
And so
well, the key difference there is family and
is family,
trustful caregiving.
Yeah, absolutely. So about 20% of people with dementia don't have families. I mean, I tell the story in the book, and this is a true story. I wrote an article about it in one of the major journals about a San Francisco street clown. So this guy, he's so for like 30, 40 years, he was the guy in San Francisco on the steps of the library who was doing these great skits, and keeping everybody laughing and happy. He becomes quite deeply forgetful, lives in a one-bedroom apartment, and he's got some money stashed away. And nobody can convince him not to get on an airplane and go to Switzerland, where they have a program called Dignitas.
Yes.
And that's where he went, and he was never seen again. And they do assisted suicide, but they also, if someone is really incapacitated in terms of their ability to push the button or whatever, they will do euthanasia as well. So that's what he did. Now, all I say in the book is, look, I don't support this because the book is really about being there and being with these people and counting them in our shared humanity. But there's a statement that I always like: judge not lest ye be judged. And I am not going to judge. For those two psychiatrists I knew in Hyde Park, Chicago, I wasn't going to judge the second one. I knew what he was looking at. I knew his personality. And for him, it actually made sense. I'm not defending it on any philosophical
But you can
grounds.
understand his point of view.
I sure as heck can.
Yeah.
And and I think we have to be aware of this because people now can go to Quebec. That's not a big trip, just get up on the northern on the New York Thruway and
Yeah.
head up to
It'd
Canada.
take you a few hours and you'd be there. Yeah.
Take do this is going on, and it's going on in the Netherlands. It's going on in Switzerland, and frankly, it's going on off the record in the U.S. a bit. So I tell a couple of stories in that chapter about uh, individuals who were deeply forgetful but still capable, and they knew they were heading in this direction, and they were able to get medications prescribed for them. Now, their neurologists wouldn't even be within a mile or two or 10 miles of them at that time, but I knew some of these families in Cleveland. These tended to be pretty well-to-do families, and they would ask me almost as a pastoral favor if I would just be there with them. And I said, well, I don't condone this, but on the other hand, I can understand it. Mm-hmm. So I actually was there on a couple of occasions, and but I did say no grandchildren can be around for this. I mean, no young grandchildren.
Sure,
okay?
Absolutely.
Yeah, because that would be a real problem. That doesn't need to be your legacy to your grandchildren.
No.
But so the Johann Sebastian Bach would be playing on the CD, and and they'd have the fire going, and you could see Lake Erie through the picture window, and spouse would be there, adult children would be there, maybe a few friends, and
a farewell party,
and it would be a very beautiful moment, and they would ask for a prayer, and since I'm sort of a meditational, prayerful guy, I would offer that for them. Usually, oftentimes ones that they helped compose, and then they would someone would bring out a milkshake with the 40 Secanals, and they would drink it down, and after half an hour or so they'd kind of fade, and that was it. And it wasn't brutal or cruel or ugly.
Sounds peaceful.
Yeah, it wasn't hopeless. I mean, some people say, isn't that giving up hope? Well, I mean, these are people who I mean, there are two kinds of hope. Psychologists say there's active hope, mm-hmm. and there's passive hope. Passive hope is, they're going to come up with a medication. Well, you know what? They haven't. There's nothing much too good out there. There are some things that on a scale of 1 to 10, if insulin is a 10 for diabetes, what we have for Alzheimer's is about a 1 or a 0.05. I mean, It's not very impressive. And it's like treating a brain tumor with aspirin. Neurologists give aspirin to people with brain tumors for certain symptoms, but obviously it has no impact on the underlying
right program. It might get rid of your headache, but the tumor's not going anywhere.
Yeah, and you're still got the same kind of situation, and the benefits are very temporary, very fleeting. So there's not much out there. That's why all the controversy recently about, I won't even go into the FDA approving a very questionable drug, but that's my feeling, is that this is a big issue, and many of our medical students are sympathetic. They would be sympathetic to that clown. Again, I don't promote this, but and I've done studies asking caregivers around the country, okay, so what do you think about preemptive assisted suicide? A third of them, oh no, never. A third of them, well,
under the certain
maybe.
Circumstances, maybe.
And another third of them say, well, you know what? Given the circumstances, it's not the worst thing in the world.
Yeah. I've debated this issue, or had my high school students debate this issue for quite a few years, and they come up with a very pretty creative realm of arguments for and against.
Yeah.
And a lot of cautions for potential abuses, which, is quite insightful on considering they're 17 years old. It's quite insightful on their part.
Well, that's the reason the healthcare system matters. So at least in Canada, if someone avails himself of preemptive assisted suicide, they weren't doing it because they were going broke otherwise.
Right.
There's public support, the same in the Netherlands, the same in Switzerland. But here, you got to look at your family situation and realize that all these assets are going to be spent down,
Mm-hmm.
and you almost feel morally obligated to get out of the way.
Yeah, there is some of that for sure.
Yeah,
Absolutely.
yeah.
Absolutely.
So I'm happy to have written this book. I've written a lot of things, but this is the one that really I hope people read it. They know it comes from the heart. It's a book for everybody. It's full of caregivers, anecdotes, little
Yeah.
vignettes. It's
Yeah, the
full of
stories are
stories, right?
wonderful. The stories are wonderful. And even the list of questions, questions and the explanations and your answers that caregivers and patients might have are really helpful in navigating our own feelings about this.
Yeah. And they're
And
not questions that I came up with, Marcy, because I was doing
no,
all
they're
these
questions that
dialogues.
actual families and patients have asked.
Absolutely, absolutely. And so I think it has a kind of usefulness, if you will.
Well, it's easy to connect to them because you know that they're legit questions,
Yeah,
not
yeah,
created just to fill a book.
yeah. Just or just sort of philosophical quandaries, right?
Yeah. Yeah, I haven't finished it yet. I mean, it's still a lot to get through, and some is emotional, especially
Yes.
considering where I am now with my family. But I'm planning on passing this along to both my sisters,
Oh,
um,
good.
because
Okay.
I think it'll help the three of us as we navigate the future with our parents, and try to figure out
Yeah.
how to make things the best we can for them along their journey.
Well, they're lucky to have you
Well,
and your
we're
sisters.
trying. We're trying. We're trying. We're committed to their commitment before the deterioration started. So
Yeah, yeah,
as they're panicking or changing their minds about things through the panic, we're mandating that we stick with the baseline, what we had all decided months ago, and
yeah,
not follow along the crazy train,
yeah. Well, that
so
and
to
but
speak.
that's to respect them,
Yeah.
because I mean I actually take that view myself. You'll notice in the book that I think that while it's true that people can quote unquote change their perspectives as they go forward into this experience, there's something about honoring the relatively intact self
Mm-hmm.
as you understood it and knew it. And that even goes for intimacy. I mean, some people in assisted living or nursing homes, um, they're almost like teenagers. They'll just have crushes, and you'll get all
Mm-hmm.
kinds of things going on. But then the real husband, real wife, looks at that and feels that it's demeaning and is against it, and we usually have a big say. But I know others who say, well, vive la différence, whatever makes them happy. I think you want to be very careful about just focusing on the the pleasures, quote unquote, and happiness of the person in the pure now,
Mm-hmm.
if that violates their identity over the course of a lifetime and their meetings over the course of a lifetime. So I like to err on that side, and I think that's what you're trying to do.
Yeah, absolutely, absolutely. As things go, it's a little unpredictable, but we're trying to do our best to do right by them and
Yeah.
to help each other through it. Like I know too many families who, when they get to this stage, they start infighting
Mhm.
over things that they disagree, or there's
Oh yeah.
financial concerns or different emotional concerns. And but my thank goodness, the three sisters are on 100% the same page. So I don't
Wonderful.
take that for granted at all,
Yeah,
because I know
it's
how
very
awful
good.
it can be.
It's very good that you're doing that. That's great.
So before I end each interview, we do the 7 quick questions. Are you ready?
Oh, okay. Sure.
Sure. Okay. So, what 6 words would you use to describe yourself? Any words you want, any part of speech, doesn't matter.
Peaceful, responsive, joyful, generative,
Nice.
dad, and husband.
Great list. Great list. What's your favorite way to spend a day?
Well, recently, taking my laptop on the Port Jefferson Bridgeport ferry
Ah, yes, I frequent it. Yes.
and getting a cup of coffee. Their coffee's okay. And I buy a round trip ticket. It's only $21 if you don't
Right.
get off, you know.
Right.
And so you can, and so you land in Bridgeport, and then they'll say, "Well, are you getting off?" No, okay, just stay on. So I get 3.5 hours of seagulls and waves and beautiful sunshine, and I can work on my latest piece of writing.
What a really great idea.
That's I do it. I do it about every 2 weeks. It's just something I love to do, and I get inspired by nature. I really honor.
Do you sit inside or do you sit outside?
Well, to be plugged in, you've got to be inside pretty
Well, yeah,
much.
yeah, that's true.
But it's still a beautiful experience, and I
Their
feel a little
pretzels are
claustrophobic.
good too.
Yeah, oh, yeah, that's right.
I like their pretzels.
Yeah, and maybe I feel a little claustrophobic on Long Island. I don't know, but getting out there on the sound brings out my creativity, and I cherish that experience.
That's a good idea. Sometimes I take my laptop and I go sit in a Starbucks or something, but and that's an interesting atmosphere too sometimes, but I never thought of using the ferry for that so that you're moving. There's a different energy to that.
There is, and just the humming of the engines.
Yeah.
It's meditational, and it's very creative. By the way, I do have a favorite Starbucks. It's the one in St. James
Okay.
on 25A. It's newer. It's really nice. I mean, there's Starbucks and there are Starbucks, but that's a
Yeah.
great one for writing. So I've been going there a little bit. But so that's what I like to do. I like to write. I love writing.
Yeah.
Um,
Me too. I find it somewhat frustrating though sometimes. Like it's an activity that I adore, but sometimes it feels very angsty, like a cerebral like birthing of something, and
you know, I just
it
go with
like
the
uses
flow.
everything. That's
You know,
awesome.
I just relax and go with the flow, and I have to rewrite a lot, but I love writing. It's a very spiritual thing for me.
What is your favorite childhood memory, or one
My
of
favorite childhood memory. Okay, well, I have lots of things, but since I'm wearing my dog shirt in
yes?
honor of Alzheimer's dogs, I had a collie named Joe John, and I just remember resting my head on Joe John in front of the fireplace and feeling very happy and peaceful.
Well, that's lovely. How old were you, do you think?
Probably 4 or 5 years old.
That's very sweet. Very sweet. What is your favorite meal?
My favorite meal, I'll pretty much eat whatever there is, but I like uh, I like shrimp tacos.
Ooh, nice.
Yeah,
Nice.
yeah,
There's a place in Smithtown or St. James. I think it is Salsa Salsa is the name of the restaurant. They have a lovely fish taco, which
yeah.
it's so good. Oh, good.
That stuff is really good. Yeah,
I
yeah.
might have to eat them tonight.
Yeah.
I'm very suggestive when it comes to food. What is one piece of advice you would like to give your younger self?
Well, I'm gonna quote Eleanor Roosevelt. Uh, It's one of my favorite quotes.
Okay.
The future belongs to those who believe in the beauty of their dreams.
I love that.
Because, you know, the mind, and this is for younger people, for me as a youngster, the mind is a gift. I think the mind is so much more, it's a mystery. It's so much more than just derivative of brain and tissue and cells. And a lot of philosophers of mind um, even talk about mind before matter. And it's big debate in neuro evolution and so forth. How do you get mind from matter?
Mm-hmm.
It's very difficult to imagine that, actually. And I've never seen a convincing study to suggest that that can happen. But mind is a beautiful thing. Your mind is a gift. And so use your mind, discover your callings, use use your talents to serve others, which is what Shakespeare and Picasso said was the major meaning of life, right?
Absolutely.
And
Those are the times
but
I
you,
feel the most alive.
yeah,
Absolutely.
that's what you do. This is why you're such a good podcaster.
Thank
So
you.
I think that this is, and it comes across, and so remember, sometimes people will try to humiliate you, and
Well,
they will try to de-dignify you, and they'll try to tell you that you don't have any gifts, you don't have any talents.
well, they're speaking about themselves, I think.
Yeah, yeah, that's right. But everybody has a gift. Everybody is in my view, every human being is a wonder of the universe.
Mm-hmm.
And I want to let people just realize that they are all miracles in that sense.
Absolutely.
And um, and every young kid, you walk up to a young kid on the street and you say, you're a wonder of creation. They're probably going to look at you like you're nuts.
Batshit crazy. Yeah.
Yeah, 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 absolutely. But I think that's actually the truth. And so if we could just believe in ourselves, in our minds, and our gifts, believe that we are miracles and wonders, and
Mm-hmm.
if we could then um, know that the future will belong to us, if we can believe in our dreams, our beautiful dreams about serving others with the gifts that we have.
I'm so beautiful. And basically the mission of this podcast.
Okay, good.
Like there was so much of my life that I spent because of my upbringing, the toxic, crazy, dysfunctional upbringing that I had. I spent so much of my adult life looking external to myself for direction and permission, and I ignored all the things that were going on inside me. And then it wasn't until my early 40s when I had this epiphany that
Ah,
looking outside for all of that was not going to get me anywhere meaningful. That everything that I wanted, everything that I dreamed of, everything that I would need in the future was all going to start inside me. And it was I had to give myself permission to begin to do anything that I wanted to do. So
that's beautiful. Inner peace.
inner peace, that's it. That's it. It's empowering. If I'm the one that's in control, sure, it's overwhelming, but it doesn't have to be. It's inspiring. It's, empowering. It's where it all
Yeah.
starts.
Yeah. And
Okay.
also a nice thing for you is that you blurred the line between work and play.
Right. Right.
I
Yeah.
mean,
I
you're working now, but you're playing.
Oh, absolutely. Absolutely. I even consider a good portion of my teaching job play.
Mhm.
Like the grading of the papers and the paperwork is definitely work. But
Yeah,
when I'm actually teaching my classes, 99% of the time that's playtime.
right.
I'm really happy standing in those rooms with those teenagers talking about life and books and communication and
That's
expression,
great.
and love it. Love
It's
it.
beautiful.
And I thought, it was the seventh career that I chose. So I thought that, within 5, 6, 7 years, I was going to be bored and on my way. But I ain't bored yet.
There you go.
Absolutely not. Okay. What is one thing you would most like to change about the world?
Well, the world's getting pretty acrimonious.
Yeah. Yeah. I think the
Nice
hard
word.
part is picking one to answer the question with. Yeah.
Yeah, yeah. And I I think we're too divided as a nation.
Hmm.
I mean, there are a lot of serious issues out there, but um,
The divisiveness is exacerbating everything.
it is exacerbating everything. And people, like I say, I'm an Ohioan, but I was actually born in New York, and my grandfather married a woman named Emily, so I'm sort of a New York product in some respects. And I went up to New Hampshire for high school at one of these hoity-toity places that really didn't do me any good. But I love my years in Chicago and Cleveland, Ohio, and in the Midwest. And I met so many caring people where they really took the time to connect and they didn't just rush past each other. And they're thoughtful people. And so this whole thing of red states and blue states, I think, is just overdone. And
Hmm.
and I wrote that book, God and Love on Route 80,
Right?
and and I'm a Route 80 guy. If you ask me where I'm from, I'll tell you I'm from Route 80, which begins at the George Washington Bridge,
Oh,
right, where it
yes.
says Route 80 West.
Right.
And then if you're in downtown San Francisco, there's signs that say Route 80 East,
It's the same road.
the same road. And so I want us all to realize that this is a good land, um, that its fields and its rivers are blessed, that there are good people everywhere, and we just need to work harder at understanding one another and not getting caught up in this incredible judgmental attitude. There are many perspectives about everything in life, and my perspective is not the only perspective. So other people have perspectives too. I may agree to disagree with them,
Hmm.
but I don't hate them. We're not enemies because we disagree.
Of course not.
And
Absolutely.
that's what's happened. I think people have gone over the line, and we need to realize that um, we're all very lucky, very blessed, and and that we can connect as a community better than we have, say, in the last 20 years.
Hmm. Yeah. It's changed a lot.
Yeah.
Okay, the last question is really shallow and superficial.
Okay.
What are your favorite movies or TV shows?
Okay. My favorite movie has not changed for, oh my goodness, like how many years? 40 years. Harrison Ford and Kelly McGinnis in Witness.
Oh, good film.
I just love it. I love the music, that French composer who does the beautiful stuff, the music when they raise the barn, and
Hmm.
you've got the Moog synthesizer going, and the contrast between the Amish community
Yeah.
and rough and tough Philadelphia and the murder in 30th Street Station. I mean, it's so powerful, and there's so
Yeah.
much that goes on there. And when I saw that movie, I thought it was the best movie I'd ever seen, and uh, it still is.
Wow. I remember the little boy who played. Who was that?
Samuel,
Yeah,
Samuel,
yeah, yeah. He looked exactly like my cousin Michael, who was the same age.
yeah,
And I just immediately identified that connection. That's interesting.
mhm, yeah.
Interesting. Do you binge watch any television? I wouldn't imagine you have time with all the
Well,
things that you do.
I don't watch television to speak of. I do. Um, like when I get home in the evenings, I'll put my feet up and talk to my wife for a while, and then I'll usually uh, do a little writing.
Hmm.
But I may take some time and on my phone and just watch a few snippets of some of my favorite movies, like Witness.
Okay.
Uh, I also, by the way, I like The Gladiator,
Okay.
Russell Crowe. There are a lot of
That
things
was a
that I
good
like.
film too.
Yeah. So I'll just look at those little snippets that you can pick up on them and enjoy those. But I don't really do a lot of TV watching or that kind of thing.
Makes sense. Well, thank you so much, Stephen. This was really wonderful. I
Well,
learned a lot, and I think the listeners have as well. And um, you're such a compassionate, empathetic man. I just loved this conversation.
well, I don't know. We do the best we can, and I've had I've been shaped by some wonderful people in wonderful environments, and teaching in med schools has been great for me
Mm-hmm.
over the years because difference between this and a college of arts and sciences in a lot of ways, there's such a commitment to the well-being of patients, and everybody's wanting to develop and form their character strengths in that direction. So to be a part of the community, even though I'm not an MD, uh,
Mm-hmm.
but to be part of that community has been a great gift, and I think has helped me a lot.
Wonderful. Thank you so much.
It's a
This was
pleasure,
really great.
Marcy. Okay, good luck to you.
This is great. Stick around
Okay.
for half a second.
Thank you for joining me for this episode of Permission to Heal. I hope you found it moving and inspirational. Please remember, you don't need anyone else's permission to trust and follow your heart. You have the power within you. Subscribe to Permission to Heal so you don't miss any new episodes, and please share this with your friends.